Welcome to Crisis in Perception, where we examine the systems shaping our world, one book at a time. So today, we're diving into a really tricky paradox, one that's right at the heart of institutional mental health care. The question is this: what happens when the very places that are supposed to heal us actually end up taking away our power to heal ourselves?
Our guide on this journey is Norah Vincent's incredible book, Voluntary Madness. And listen, she didn't just write about the system from the outside. No, she lived it. Using a method called immersion journalism, Vincent actually checked herself into 3 completely different mental health facilities. She became a patient to understand what it's really like from the inside out. So this wasn't just some academic research project, it was a deeply personal and pretty risky experiment.
This quote from Vincent really just cuts right to the heart of it all. It makes you stop and ask a pretty tough question, right? Can you really heal someone by, well, taking away their freedom? That fundamental tension, that push and pull between care and control, that's exactly what we're going to unpack today.
All right, so here's how we're going to break this down. First, we'll look at her experience as the undercover patient. Then we'll dig into the paradox of care that she found. After that, we'll see how that paradox creates a system of control, and we'll wrap up by looking at a different path forward: healing and freedom.
Okay, first up, the undercover patient. So what's wild is that Vincent's journey actually started with her own real depressive breakdown, which put her in a locked ward. And that experience, as terrifying as it was, it planted a seed. She decided she had to go back, but this time, not as someone in crisis. She went back as a journalist, determined to document what really goes on inside these places.
And this is why her method, what's called immersion journalism, is so incredibly important. See, this isn't about standing on the sidelines with a notepad. It's about actually living the experience. To do this, Vincent presented with real symptoms, she voluntarily signed away her own freedom, and she completely submitted to the very system she was there to investigate. That level of personal sacrifice, that's what makes her insights so powerful.
And she didn't just do this once. No, she went to 3 totally different kinds of places to get the full picture. First, there was Merriweather, which was this chaotic urban public hospital. Then St. Luke's, a much more controlled private clinic. And finally Mobius, which was a completely alternative program that, really challenged the whole idea of what institutional care should be. The fact that she saw this whole spectrum is what makes her findings so compelling.
All right, that brings us to the core of what Vincent discovered. We're calling it the paradox of care. And honestly, it's this central and frankly deeply unsettling contradiction that she found, in one way or another, in every single place she went.
So here's the paradox in a nutshell. The system, in the name of providing care and keeping people safe, often ends up stripping away a patient's autonomy, their ability to make their own choices. But here's the thing, as Vincent argues so powerfully, that very sense of agency is the key to any real, lasting recovery. And that's the fundamental conflict running through her entire book.
Just look at the gap here between the intention and the reality. The system's goal? Healing. But the effect it often has? A loss of will. It's meant to provide support, but can create a sense of helplessness. It promises safety, but can result in this deeply dehumanizing experience where you're not a person anymore. You're just a diagnosis and a set of rules you have to follow.
So, if the so-called care can actually get in the way of healing, what is the system prioritizing? Well, that brings us to our next section, a system of control. Because what Vincent found was this consistent pattern where control, not genuine recovery, seems to become the #1 goal.
So let's talk about the first pattern. It's how quickly distress turns into confinement. Just imagine it. You're having a really hard time, you reach out, you say you're depressed, maybe you even mention a fleeting suicidal thought. Vincent found that in an instant, poof, you've accidentally set the whole confinement system in motion. A simple cry for help can turn into a total loss of your freedom, just like that.
Okay, the next pattern is a little more subtle, but it's really powerful. It's this shift where treatment becomes all about compliance. It's not really about getting better anymore. It's about playing the game to get out. You quickly learn to be, in Vincent's words, docile, subservient, frightened. Because if you push back at all, that's just seen as another symptom. Your actual recovery takes the back seat to how easy you are to manage.
And that leads to what might be the most damaging pattern of all, the complete erosion of your agency. Just think about the word voluntary. When you voluntarily check yourself in, you're thinking, okay, I'm making a choice here. But Vincent's point is that it's actually the exact opposite. It's the surrender of your will. It's the last free decision you get to make until somebody else decides you can be trusted with your freedom again. I mean, how can we even call that voluntary?
This image, I think, just says it all. You've got this door, it says help on it, but it's locked. And when the price of getting through that door is your own freedom, you really have to ask yourself, is that still help? And maybe more importantly, what does it say about us as a society that this is the deal we offer people when they are at their absolute lowest?
So, is this just how it has to be? Is there another way? Well, in our final section, Healing and Freedom, we're going to explore just that. Because Vincent's journey wasn't just about exposing what's broken. It also gave her a glimpse of a much more hopeful alternative, a model that's built on trust and empowerment instead of control.
This place was called Mobius, and it ran on a completely different set of principles. The focus wasn't just on medicating away symptoms. It was about intensive therapy that looked at the whole person, mind, body, and spirit. It was treated like a partnership, not this top-down power dynamic. Patients were actually treated with respect. They were given freedom, and most importantly, they were given the tools to start healing themselves.
And this really gets to the core of Vincent's ultimate message, something that became crystal clear to her at Mobius. The system can't heal you, a pill can't heal you, even a doctor can't heal you. The most powerful engine for recovery is inside the person themselves. So the goal of any good mental health system shouldn't be to break that will. It should be to nurture it and help it grow stronger.
So we're left with this really big question, one that challenges the entire foundation of our mental health care system. What if we just shifted our focus? What if, instead of trying to manage illness, our primary mission was to restore agency? What if we truly empowered people to be the architects of their own healing? Just think, what would that world even look like?
For the full long-form deep dive into this book and its ideas, follow the link in the description. If you enjoy this kind of systems-level analysis, please like, subscribe, and comment with books or topics you'd like us to explore next.